is Lungelwa. I am the Stakeholder Relations and Community Engagement Manager for FPD Research Unit in East London. I am with Sis Ndumino Ngqelwane. Sisi, can you please introduce yourself?
Morning, Lungi. I am Nondumiso Ngqelwane. I'm the TB Program Manager for the Buffalo City Metro Health District. That is, I'm overseeing the TB program throughout the district in all the facilities that includes the clinics, the community health center, and the hospitals. I'm doing e-updates about the new developments in the program and also monitor the implementation of the guidelines in the program so that we can get better outcomes and also see to it that patients are treated accordingly. Thank you.
Oh, thank you, Sis. How long did you work for the department?
I started here in the Eastern Cape Department of Health in 1994. Otherwise, my background is from the Gauteng province then when I was working in hospitals.
Oh, thank you so much. Did you observe any changes in the community level regarding the TB regarding TB post COVID?
Yeah, what I've observed, is that I'm sure during the period of COVID, we all concentrated on the COVID part, forgetting that the TB is still there, especially that they shared the same symptoms. So even there in the community, what they were always told about was COVID. So now everybody forgot about TB, and now there are few people that are coming to facilities to be screened for TB when they have symptoms. I'm sure they always think that no, since it was COVID, yeah, they still having COVID. So okay, that's what we have noted.
Oh,
that decline in numbers, yes.
So now the numbers are starting to pick up for screening.
Yes, they are starting to pick up now because we have started a turnaround strategy to say, let's go straight to the communities, not wait for them to come to the facilities. So our strategy is now community-based. We want to strengthen the community-based strategy.
Oh, that's nice. What is the most common type of TB around BCM?
Yeah, I would say we have noted the pulmonary TB, the DSTB pulmonary, and also we've noted that drug-resistant TB, especially the RIF-resistant, it is picking up. Yeah, so yeah, we've noted that those DRTB patients did had TB before. So that's what we've noted.
Okay, thank you, Sisi. What is the most common cause of non-adherence in PCM?
I think, Lungi, non-adherence from the TB treatment is that most people, when they are diagnosed on TB, is because they are having symptoms or they are feeling symptoms. So immediately, let's say after 2 months on treatment, those symptoms started to disappear or are lowering. So people think that the TB is no more there and they feel that they are gaining weight, they are fresh now. So they just stop TB. Not that they are not told when they start TB that they are going to take it for 6 months. For some reasons, people they tend to not even to finish generally, they don't even finish the antibiotics that they are given by the doctor just for 7 days. When the symptoms are lowered, they stop taking treatment. So that's what we have noted. That is why I've said, really, I think we need to focus there at the community to give people, to empower people about TB and everything that is related to TB. Thank you.
Oh, okay. So you've already mentioned some of the strategies that you would recommend to improve adherence of patients that are on treatment. Do you have any other strategies apart from going to the community? Is it, or your visit about the community, what are they going to be about? The education or providing services?
Yes, basically the most thing is about giving information, that is education, to the people in the community at the household level, because if one is having TB in the household, so they must be free to share their status of TB in their household, so that at household level we can screen and test for them, because it's very important to find TB cases in the household level, and also going to a facility to emphasize about the continuous adherence education to the patients, especially starting from the time they are diagnosed, so that we follow this journey together with the patient until they finish the TB treatment. Another thing that I think is so important is to market this program. That is, we use community radio stations and the billboards and pamphlets, so that people can be free to see this TB message in the billboards, as well as seeing other things that are promoted. Like, for instance, you see that they are promoting KFC. So I would like those billboards to be there talking about TB, and not talk about TB when it's March month, you know, talk about go out as it is done to other things. Marketing, I think it's a very powerful strategy to improve this adherence.
Wow, thank you so much. In your opinion, Sese, what is the contribution of research in TB, and especially around BCM?
Yeah, thank you, Lungi. There are researches, they are continuously done at the BCM. Yeah, I've talked initially about the importance of the contact tracing and management. We have seen that OFPD was involved in a research that they were going to households and screening and testing, though at household level, those ones that are staying with an infected person. We have noted that by they're having a little machine that the Omni machine that they test those people at the household level, at their relaxed environment. So we've noted that that yield good results. And that's what we were saying. We will be very happy if that can be rolled out to all the areas, so that we can be able to increase the case finding, because we are convinced that there are people who are having a TB in the community. But our challenges is that we don't have enough manpower, like the health promoters, that we can go and do marketing in the communities, and also the testing at the household level, as it is done by the HIV program, because they go outside in the community, they do the testing in the household level. So we'd like that what is done in HIV to be done also in TB. So we've noted what FPD have also done to us. And also another research that we were so excited about is the research of TB in men, that we've noted that males, yes, they do have TB, but they don't come in numbers in the facilities. So that's why I was saying targeting the community will yield better results.
Wow.
Thank you.
Thank you so much, Sister. I think the last question that I have for you now that you are talking about research, do you have any research questions that you wish to address in near future?
Yes, throughout, as I understand, I think if any, we are having a very minimal researches that are underway, especially in the area of adherence. I'll be very happy if we can be involved or supported in that area of adherence. Why people are taking treatment and stop treatment before it's 6 months elapsed, because we are convinced that TB at least is taking for 6 months, and there are no more pill burden now. But why people are interrupting treatment to an extent that they default. So if you can be supported in that research, in that question, so that yeah, I think I'll be very happy.
Oh, thank you so much, Sister. I think lastly, I just want to check if you have any closing messages that you want to share with us.
Yes, thank you, Lungi. I'd like to say to FPD and Desmond Tutu, we are so grateful to have you in our district. We are really blessed, and the researches that we're still undergoing with you, like for instance, if I can mention the TB and mental health, all people all the staff in the Buffalo City are so excited, especially when you shared the area that we've already done in that study. They were so excited to an extent that they were saying, can't this mental health target to us as employees, because we are all affected in this mental health issue. Otherwise, thank you very much. I hope that you are going to be with us for quite a long time, because there are questions that we would like us to help with, especially with the TB, especially that everybody is neglecting TB, thinking that HIV is the thing to focus on. Otherwise, thank you very much for your support.
Thank you once again for your time, and bye-bye.
Bye-bye.